Good morning, everyone. I'm Jennifer Parker, a member of the Public Relations team here at Boulder Community Health. We are live on Facebook today at Foothills Hospital talking to Ann Walker. Ann is a BCH pet therapy volunteer here with her gorgeous golden retriever dog, Nina. Welcome, Ann.
Welcome. Thank you so much for having us both.
Yes, thank you for sitting up here so nicely. Today we want to talk and explore the BCH Canine Core program. These are some 40 teams of dogs and owners who are pet therapy volunteers. They bring comfort and joy and healing to patients and family members and staff here at Foothills Hospital, at the Tebow Cancer Center, and also our campus over on Broadway. Our program has been going for 18 years strong, so that's a really long time. If you are interested in becoming a pet therapy volunteer, you can check out our application process. It's online at bch.org/pet therapy. So we're live here on Facebook today. I really appreciate Ann doing this with me because we want to take your questions and comments. If you have questions for Ann about the pet therapy program or what it's like to work with Nina here at a hospital, work with patients, please jump on and write in your comments and we'll try to read them off and address them. So one question that we had for you, Ann, is tell us a little bit about how you got started with the Canine Core program here at BCH.
We started about 3 years ago, Nina and I, and we started because I feel very strongly about volunteering, and Nina loves to work, and she and I would get stopped frequently, may I pet your dog? So being at the part of the Boulder Canine Core seemed like a very natural fit for that combination.
She's very friendly. So how do patients react when you walk in with Nina in a patient room?
Usually the first thing they say is, oh, she's so pretty, and I miss my dog. We get a lot of tears, actually, because people that we visit are in the rehab place in the hospital, and so they're there for a bit and they miss their own dogs. And then once they get hold of this massive amount of hair, they say, ooh, she's so soft.
She is soft. She's beautiful, beautiful dog. So the Canine Core program here at Boulder Community Health really goes and speaks to the patient experience that we are trying to give patients. We treat people, not illnesses. We serve our patients best when their holistic and emotional needs are taken care of, as well as their physical issues. And we have a lot of stories that we want to talk about today of evidence of that. That's where the BCH Pet Therapy program really comes in. They're coming into the hospital, they're bringing staff comfort, they're bringing patients joy, and real stories of healing, actually, that we can get to. So, Ann, I heard that you and Nina often get to go and visit the children who are part of the pediatric rehabilitation unit at our Broadway campus over at Boulder Community Hospital. Some of these children have autism and sensory processing issues. Can you tell us a little bit about how the children react to Nina?
First of all, they're very surprised to see a dog in the hospital. They think that that's very different. And oftentimes we'll get the parents who say, now remember, you're to ask, may I pet your dog? And they do that. And then to break the ice a little bit, Nina and I I have her sit and wait, and one child will come up at a time, and I'll say, she really wants to know what you had for breakfast. So please put your hand in front of her so she can smell what you had for breakfast. And then we might rattle off some breakfast things, and oh yeah, she knows you had that. That's one of her favorites.
That is so cute. What does that give to the children then?
We try to get right down to their level. I kneel down and get about to Nina's level, and my job is to protect Nina. A lot of kids will come over the top of her, or they'll want to be, right in her face. And so it's a teaching moment for how to be with a dog, just generally speaking. And
yeah,
they often want to know about this. This is a gentle leader. And they say, oh, will she bite me? So
Oh.
you're not going to get a dog bite in the hospital for sure.
Right. These are very well-trained dogs that go through a process. And if you're just joining us, welcome. We're here live on Facebook at Foothills Hospital today. We're talking to Ann Walker with her beautiful dog, Nina, who they are part of the BCH Canine Core program. They bring comfort, healing, and joy to patients, staff, and family members. If you're interested in becoming a pet therapy volunteer at BCH, log on to bch.org. /pet therapy. So we want to hear from you. Jump in with your comments or questions. I see some people jumping on. Deborah. Hi, Andrew. Liking and loving what we're doing, so that's great. I wanted to get a little bit more into some of the healing stories that I was told that these canine corps and, of course, their human volunteers are responsible for. One story that we have that Pat Diamond actually told me, Pat is our BCH Director of Volunteer Services. She's got great stories. One story is about a stroke survivor here at Foothills Hospital. Boulder Community Health, I don't know if you know, is a primary stroke center. That means that we have a comprehensive stroke program. It includes our emergency department, our neurologists, our rehabilitation and physical and speech therapy providers. We have the most comprehensive rehabilitation services in all of Boulder Valley in the area. And we offer home care to people who need a little bit more help after they go home. So the story that we heard is about one stroke survivor who lost his ability to form words. I think that that's a really common ailment when folks have, unfortunately, a stroke and they are stroke survivors, is having to try to relearn how to actually form words again. Mm-hmm. And the story goes that one of our BCH Canine Corps dogs actually came in the room, and the person who hadn't been speaking at all said the word spontaneously, dog. Because the dogs just inspire this sort of healing in people. Do you have any stories like that where you were kind of in the room and you kind of witnessed somebody reacting to Nina in a really positive way?
I do. I have several stories of people who burst into tears when they see Nina because they miss their dog, and it all just comes out. But I do have one story that's not unique to Nina, but it's an interesting story. This is a very food-motivated dog. Understatement of the century. She's a golden. She can't help herself. So there was, when we arrive to start our rounds, she often would just beeline right to the nurse's station. People feel that they're giving a lot of love if they give a dog a treat. And that's very distracting to Nina. But I also want to accommodate the staff who love having her come. So normally we get off the elevator and she beelines right to where the snacks are. But on this particular occasion, she didn't do that. She and I got off the elevator, and there was the lobby area, and it was full of physical therapists, nurses, family members, and a very seriously injured patient who was in a wheelchair. Everybody was very droopy-faced, sad, frustrated, almost angry. It wasn't a happy moment for anybody. So Nina gets off the elevator. She takes in the situation, and rather than beelining to the treats, she walked right up to the patient in the wheelchair, started inhaling this person from the waist, down one side, up the other side, back and around. Everything was very quiet. And then she just laid her head on the person's lap. And she stayed there for quite a long time. And there was a collective sigh of relief from everybody, and lots of tears being held back. The person started to pet her, and you could just see an emotional release for everybody, including the family members who were there. She just stayed parked there. She wasn't there for the treat. She didn't bother with the treat. She was there to do her work, and she does take it very seriously.
That's a really professional dog. That's amazing. What a great story, heartwarming story. I bet that person and their family really appreciated her in that moment.
I think, and I know that they did, and they're very welcome for that. And really, the pleasure is ours. She gets, and I too get a lot of pleasure out of doing this.
Yeah,
you can just see very immediately, very firsthand. Oftentimes, we'll enter a room, and sometimes the patient isn't in there, but the family member is waiting for them to come back from, physical therapy or something. And oh no, you don't need to come in. And I'll say, would you like a pet visit?
Oh, it's family members, right?
Yes, and yes, I would. And she is so ridiculously soft.
Yeah.
She's very calm, but she will place her head on your lap. She'll lean into you. She knows. She especially knows when somebody needs a little extra love.
That's great. That's great. And we do have a couple questions. One from our friend Selene. Hi, Selene, who works here with us at BCH. This is a great question. What do you and Nina get out of the program? We just talked about what patients and family members get from the Canine Core program. What do you think you're receiving yourself?
I think I receive the relief that they feel. It gives me a lot of pleasure and pride in Nina that she can offer this to people, and that makes me feel good. You always get back more than you give when you volunteer in any situation, and it's no different here. I get a lot of joy out of doing this.
What do you notice a difference in Nina after she's done her work shift?
We do, very much. My husband and I notice when she comes home from her work, she actually wants to be by herself. She curls up in a ball and she sleeps pretty hard for a good hour.
Oh, wow.
It's tiring.
Yeah.
I think she's an emotional sponge for a lot of this.
Mm-hmm.
And in knowing that I need to be aware that once a week for an hour to 45 minutes to an hour and a half is about the average span, that I need to know that she needs to rest afterwards. It's not something that she can do every day.
Yes.
Twice a day, or she needs to rest afterwards so she can be very effective.
Right.
She does take it seriously.
And we have another question here. This one's from Sandra. Hi, Sandra. The Canine Core, she said, were particularly healing when we lost a staff member recently in the OR. Unconditional love. These pups have a keen sense of who needs them. When I lost my dog, Amigo, who's another pet therapy volunteer's dog, he walked straight to me and gave me love when I needed it most. That's very sweet. That just, speaks again to what the staff are getting from this program.
People often ask me, how do you get Nina to do, fill in the blank, whatever that is. And I don't get Nina to do those things. Nina does those all on her own. And she's ready to get down, or maybe give you some love.
Oh, thank you. Very sweet.
Okay.
So cute.
She knows when people need it.
Yeah.
I even have friends, neighbors, or something. We're sharing stories.
Yeah.
Something's particularly upsetting, that she will immediately walk over to that person and lean or lay her chin on someone.
Yeah. So that's great. That's interesting. We have another comment, another question from Mary. Hi, Mary. I was wondering what the process would be to have your pet become a therapy dog. We have, what was your process? Let me ask you.
It's pretty involved. There are 3 different groups who will register you as a therapy dog team. One is the Alliance of Therapy Dogs, which is the one we went through. There is also Pet Partners and Therapy Dog International. We did the ADT, and that requires a background check. And then it also has 3 observation and testing sessions where someone will watch you 2 of those times are in a medical setting.
Wow. So it's pretty thorough then.
It's, there are several steps. Then you need to go through the Boulder Canine Core and go through their steps.
Wow.
Then you need to become a volunteer, just a general volunteer here at the hospital.
Boulder Community Health, right.
Yes. And also From there, you do some shadowing. It's a long process. It takes several months. That's not to discourage you. It's just to make you realize it's more than an afternoon thing, and you walk in and anybody can do it.
Right. No, I think that there's a great deal of criteria actually on our website on bch.org/pet therapy if you're considering actually joining the program yourself. There's an article on there called "Is Your Dog a Good Fit?" And this is a really great place to start, and a really important piece of it, because some dogs are just not going to be a good fit. Therapy dogs must be calm. They have to be obedient, not easily distracted by live TV, and they have to love to be pet by a variety of people, children, and all sorts of people. Dogs have to be at least 2 years old, and the handler has to be an adult. So those are some of the points. There's more on our website. You can check that out. And you touched on this briefly earlier, but what advice would you give to anyone thinking about joining the Canine Core program? What should they
I would say Nina's very natural at this. As I said, it's not something I taught her. But take a look at your dog and see if she is one of those dogs who immediately goes to the person who you're walking down the street. Does it go to the dog? Does it go to the person? What kind of behaviors does she or he show that make you think, oh, because just because you love your dog doesn't mean everybody loves your dog. Or maybe you want to be a volunteer at the hospital, but your dog really isn't into it.
Not going to work out. Okay, so there's a lot to it. And we were just touching briefly on some patient stories of healing by some 40 dogs, four-legged friends, plus their owners who come in and bring joy and comfort and healing to patients and family members and the staff here at Boulder Community Health. And I just wanted to touch on another one that Pat told me. At Boulder Community Health, we are really committed to mental health in our community. We heard about a letter that we received from someone who actually went through the behavioral health program over at our Broadway campus. They said that they wrote in that they really weren't connecting to their treatment very well until the Canine Corps volunteer walked in. And through those visits with the dog, this man who was very depressed said that he began to imagine a future for himself. Nice. Where perhaps he was a dog owner himself, and that was kind of the turning point for the dog. So we hear a lot of these stories like, oh, they're cute and it's so nice, but this is real healing, therapeutic value.
It is very real. Sometimes if you don't want to talk to anybody, you can talk to your dog or a dog. They listen and love unconditionally, and they have a sense, they have an awareness about how you are, even if it's not you. It's just people in general. They have an awareness, and they are incredibly therapeutic. There are lots of teams here. Anytime I walk into the hospital, they say, "Oh, we thank you so much for being here." I often see the same parent and kids doing the outpatient rehab, and I have children who go to Nina right away. Oh, she's here, Mom, this week. She's here. She's here. So I think they have something to look forward to seeing Nina as part of the fun part, maybe of heading to their appointments. And my stories are not unique. They happen to every one of our teams. There are lots of teams who have people who are, oh, this one's my favorite. Oh, we love when we see, whatever team it is. So it's not unique just to Nina. It's an amazing program and very, very dedicated handlers with their dogs.
Right, and dogs just have this innate therapeutic ability, as we all know, and mental health is something that we're talking a lot about actually in the community. We just started a 5-part series on confronting the mental health challenge in our community, and you are welcome to check that out. We're going to have some dates coming up where you can go to a free community health lecture to talk about mental health issues and hear from experts in our community. There's more information about that on our website at bch.org/lectures. And it makes me really realize and value working at Boulder Community Health, which is an independent, not-for-profit health system, only one of 2 left in the entire state of Colorado, that BCH can solely focus on meeting the needs of our community, and mental health is definitely one of those. It just means that resources don't flow to another community or another state. We can keep our resources right here to confront the challenges, the healthcare challenges that we have in our community, and I think that means a lot. The BCH Foundation is actually raising money to fill the gap in our community in terms of mental health needs. They're raising money for the new Della Cava Family Medical Pavilion that's actually being built just adjacent to Foothills Hospital right now. They've been pouring concrete, and it's really exciting to see that building go up. The other thing that they're raising money for is the Mental Health Endowment. Now, this is a long-term fund that's going to support the mental well-being of our patients along the continuum of care, and that means just empowering them to strengthen and maintain their personal independence as they address their mental health. It's a really big issue in our community and a lot of communities across the country. So if you want to learn a little bit more about that campaign, please log on to bch.org/mental health. I mentioned that BCH has these mental health, confronting the mental health crisis in our community lectures. It's a 5-part series. We're actually partnering with the Rotary Club here locally, as well as mental health partners to bring that to people. So for more, go to bch.org/mental health. So I just want to say, if you're just joining us, welcome. We are live on Facebook at Foothills Hospital. We're talking to Ann Walker and her beautiful dog, Nina. They are part of the BCH Canine Core program, which is a really important program that brings healing and comfort and joy to staff members and, of course, family and patients here at Boulder Community Health. Are there any other stories that you can think of, or any other tips for folks who are interested in this program?
I would say that one thing that makes this really easy to do as a volunteer is that the whole hospital supports the idea. The staff are very welcoming and excited when you arrive. So there's tons of support. You're, oh, we're so happy you're here, is what we hear so often. And it's true. If we didn't have that, it would be much different coming to something like this.
Oh yeah, probably makes your life just completely joyful to bring that much joy to people.
They look forward to each of our teams arriving, and that support is wonderful. The volunteer department heads, Kathy and Pat, are wonderful to work with, easy to work with, fun to work with. So if you think your dog could do this, do it. Go to bch.org/pet therapy.
Yes.
And we welcome you being interested in joining us.
That's great. And, we were just talking about stroke and the healing power of dogs for stroke survivors. And we actually have a free community health lecture. Let's see if I can get it in there, coming up for our community. That's okay. We love it. Recognizing and treating stroke. This is targeted actually to women in Lafayette. Oh, you're so cute. And that's going to be on Tuesday, February 6th from 7 to 8 p.m. So log on to bchlectures.org/stroke for more information. Another story that I heard about a stroke survivor is when the dog came into the room, the stroke survivor who had not been able to move part of his upper body actually just involuntarily reached out to pet the dog.
That is awesome.
So real stories of healing. It's just a beautiful program that we have. So as we wrap up our Facebook Live, we want to take a moment to thank you, of course, Ann Walker, and your dog, Nina, for making the time today. Thank you. It was a pleasure speaking with you. We also want to thank Pat Diamond, who is our Director of Volunteer Services here at BCH. She does a great job. She's the best stories, and she runs this program with Kathy Burchett. We are very, very grateful to both of them. Actually, Pat just took some wonderful photos of the BCH Canine Core annual meeting. which is the most adorable set of photos that I think I've ever seen. And we posted them just below here on Facebook, so check it out. We also want to thank Jan Fincher, one of our BCH volunteers, who helps to run the Canine Core program, along with Robert Kerr. Robert Kerr has a dog named Blue that's very well known because he's a big, isn't it, a Malibu Husky? Or I'm
not sure of the breed, but there's a lot of hair involved.
It's a big
lot of howling. And very, very sweet dog. Yeah,
it's a very vocal dog. That's what people say. So we know when he arrives here at Foothills Hospital. We also want to thank Mary Stoops and her gorgeous dogs, Tanner and Willow. We call them Tuesday Tanner and Wednesday Willow because they come on different days. And Joy Wexels and her dog Amigo, who we were just talking about, who Sandra mentioned in the comments. Thank you. So these are really people in our community, volunteers, neighbors helping neighbors, who are truly partnering to create and care for the healthiest community in the nation here at Boulder Community Health. And it's just, it's beautiful to see. We're going to have a few more Facebook Lives with our providers in the next couple weeks. I just want to tell you about them. Coming up, we have Dr. Iyengar, Dr. Srini Iyengar, our new structural heart and valve cardiologist. He's actually moved here from Florida. He's an expert in structural valve and heart procedures. He's going to be talking about his new TAVR procedure. We're very excited about that. So you can tune in for that. That's going to be on February 21st at noon. And we'll post a little bit more about that on our Facebook page. We also want to invite everybody to our next Walk with the Doc event. Walk with the Doc is great. You can bring your dog. Actually, I'm not sure about this next one next Saturday because it's indoors. It's indoors at CU Boulder. CU's athletic indoor practice facility on Folsom. That's at 8 o'clock in the morning on Saturday, February the 10th. You can find out a little bit more about our Walk with the Dog program, and dogs are usually welcome at bch.org/.
Most places in Boulder, right?
Yeah, I think so. Isn't that like you have to welcome dogs if you want to be in Boulder? But we'll find out. bch.org/Walk with the Dog. So if we inspired you, if Anna inspired you, if Nina inspired you to become part of our Canine Core volunteer program, please visit our application process at bch.org/pet therapy. Thank you so much for watching. Bye.